Now, we all tell our patients that it's 80% diet and 20% exercise. What if you didn't have to go to the gym for exercise? So that's what our next topic is about, non-exercise activity thermogenesis, the secret of weight management. This is by Dr. Jayanta Kumar Panda. I would like to call upon the chairpersons. We have Dr. Chandrasekhar N., consultant physician and diabetologist at Shekhar Specialty Center, Bengaluru. We also have Dr. Arun Kumar C., consultant physician and diabetologist at Arvi Hospital, Hoskote. All right, it's all right. Okay, so could you please introduce our esteemed speaker for us?
Good afternoon. I think after a good session on the gut bacteria, I think now a lot of GLP-1 agonist around the corner and a lot of weight loss mechanism happening. Now how to maintain this consistently through not very aggressive exercise, through some simple movements and daily activities. To enlighten on this, we got Dr. Jayanta Kumar Panda, who is a consultant physician, diabetologist, and professor at Sri Ram Chandra Banja Medical College Hospital, Cuttack, Odisha. So the session is yours.
Thank you, sir. It's a very exciting experience to speak in a silent hall. This is the first time I'm practicing, and really I like the concept because parallelly two halls are there and there cannot be any noise disturbance, and very closely to your ear the voice will reach. After beautiful session by Parikya about the food, mood and the gut-brain axis, I'll take you to a different world in it, which many of us are not aware. The non-exercise activity thermogenesis. So if we talk of burning calorie, we just mean exercise. And day in and day out you speak your patients, go to gym, walk, aerobic exercise, burn calories, cycling, jogging, yoga, all you have been telling, which is structured. Here I'll give you a clue which burns more calorie than exercising, and as such is formal, not casual. It's not structured. It's by talking, it's by walking, you practice in the lifestyle the burning of calorie. And easily you yourself can do and talk to the patients. It doesn't have any budget, it doesn't involve any cost. It's just a habit. And see what an important part of losing calorie we all are missing by not doing that. So this is one of the secret of the weight management. I'll be taking you through. It's small movement but big impact. I thank Disha for this CPD program, very beautifully designed, the topics, the speakers, and give a big hand for Dr. Manohar, whose individual effort has brought us so far, and we are here for the beautiful program. So NEAT is something defined as the energy you spend on everything you do, not sleeping, not eating, or intentional exercise. It's as simple as that. So sleep, eat and exercising are excluded, and everywhere. Suppose you are sitting, I am standing. I am burning more calorie than you. That's why sitting is the next smoking, the person keen. So energy expenditure outside sleeping, eating and exercise is what is non-exercise activity thermogenesis, and there is the emergence of the concept, the obesity research application came, and continuous muscular activity and daily energy dissipation burn this calorie, and there is a clinical relevance because there is a weight gain resistance and weight loss maintenance. And in this energy balance, in the high need and the low need, we see what change is there. So it's a largest variable component of TDEE, which is total daily energy expenditure, and a powerful modifiable target in obesity management. How? I'll tell you. In 1950s, we noted there is the initial calorimetry insights. Few of the people burn more calorie than others, with basal metabolic rate and exercise remaining same. And then came the concept of non-exercise activity thermogenesis, and Levine et al. Did seminal studies around 2000, that's after 50 years, where the focus was on need, and from exercise centering to movement centering paradigm came in the weight reduction. When the GLP is rampant around and everyone comes and speak you regarding GLP, and Chandrasekhar sir was telling about the sarcopenia, you have something which will not only keep your muscles strong, keep your calories burned. Around 20 to 30% of the daily calorie burned by basal metabolic rate. This is your physiology. The energy required for the basic life-sustaining functions at rest. Around 10% by thermic effect of food, when there is a digestion, absorption, metabolism of nutrient, assimilation, there is energy consumption that is known as the thermic effect of food, around 10% only. The exercise activity thermogenesis is what you do: cycling, jogging, walking, gym, push-ups. Their energy during the structured exercise and planned physical activity that comes up to 15%. So 30%, up to 30% is the BMR, up to 10% is the thermic effect of food, up to 15% is the exercise activity thermogenesis. But here is neat, the non-exercise activity thermogenesis, which is a distinct feature and magnitude and can take you up to 50% of the calorie burn in a day by highly variable and the powerful driver of the health. That's what we'll talk about. Why need matter in obesity medicine? The obesity is an epidemic now. We realize the women are becoming more obese than the man, and children are becoming more obese than any point of time. Many young adolescents are sticking to GLP-1 very irrationally, without any medical prescription, and having lot of problems like sarcopenia. The sedentary society, the occupational seating, the technology-driven inactivity, reduced daily movement is the responsible cause for this obesity, and exercise alone often fails because it's really difficult to make a structured exercise for a busy professional, and all of you becoming doctors, you don't have a control on your own time. The missing expenditure component, the missing energy expenditure component of TDEE, or total daily energy expenditure, is NEAT, which the hidden calorie expenditure and impact on long-term weight regulation, daily movement outside exercise. So it's NEAT is the everyday is, and small movements and big result is what comes. Here I'll give you example, spiritual example. Sri Aurobindo of Pondicherry Ashram told, yoga is not sitting and meditating. Yoga is not going to jungles. Yoga is not wearing saffrons and separating yourself from the people who are in the world. You can work, you can earn, you can marry, you can walk and talk and practice yoga, practice spirituality. And that's what is required for the world. People knowledgeable, know approach to life, behaving spirituality in daily life and practicing yoga. It's not that you go to a deep forest and do some meditations and that is yoga practice. So similarly, if you burn calories while moving, talking, eating and doing your lifestyle daily, it it doesn't become a headache for you, for your patients. To the energy balance, the foundation of the weight regulation, you know about the intake, expenditure, weight maintenance, and you have heard about the bank balance theory many times. That if you earn more, you deposit more, and you spend less, then you become swollen up, or the obese, or the fat, and the weight maintenance becomes an issue. So the energy intake, the dietary calorie, the macronutrient, and feeding behavior is always to be regulated. The energy expenditure, like resting as well as activity as well as thermogenesis, needs to be controlled, and the positive energy balance always result in the weight gain. So here something the positive is not good. We want a negative thing in the energy balance. And negative energy balance is weight reduction, fat mobilization, and the dynamic energy balance is when it's keep on going, the energy is coming and going, the adaptive responses and the metabolic compensation. So the components very well known to all of you is the energy you spend daily activity, that occupational activity like walking at work, standing tasks, manual labor. So physically you can clean your floor, you can clean your table, and then if you see your patients, I have done the reverse. The patient is sitting and I am standing. Many times in busy hospitals you see the patient is standing and the doctor is sitting and disposing, especially after COVID, in the non-touch technique. But I ask my patient to sit down, I go around, ask the history, examine, come write a prescription standing and give them. Even I started taking my breakfast, lunch and dinner standing without sitting in the dining chair. Because if you sit, you eat more. If you sit, you burn less calorie. Domestic activity like cooking, cleaning, gardening, it's like keep on moving around. And there is a belief that those who move their hands and legs more, this is something very unreligious people are taking. But now it has proved otherwise. If you move your hands more, if you clap more, if you jump more, if you run more, you burn more calorie, and that is what they need. The transportation activity, I can walk down to the other building, level 2, have my registration and come back. I may not use the lift. Cycling, stair climbing, some practices you can do daily. Please, please, please have a cycle if you haven't at your home, and you may have very costly cars, but do at least 30 minutes of cycling daily in the morning and the evening and see the change which I have started of late. Leisure activity like shopping, like playing, like household movements, spontaneous activity like visiting. Visiting was I was talking about the postural changes, the restlessness. So this is something by your lifestyle, by normal activities you burn and you get. So the difference from the exercise, both matter. I don't tell that stop your exercise. But the difference from exercise, the definition is the planned versus spontaneous activity. Exercise is planned, but NEAT is spontaneous activity. Intensity difference is the moderate vigorous exercise versus low intensity movements. If you do a pushing or do a cycling or running, you are doing an intensive activity. Here it's a low intensity activity, but you do more frequently. Duration difference, the short exercise session versus continuous daily movements. So it's throughout the day, from morning to 9, in the office, in the home, in the garden, with children, with clients. This goes on. And exercise expenditure comparison is the accumulated calorie burn and the long-term impact. And the adherence and sustainability, the patient compliance and the real-world practicality is important. And the clinical implications tell you the complementary roles in a obesity management. So we are very concerned. We are prepared to take injectables. We are prepared to spend money for that because we usually fail to lose more than 5 to 10 kilos in exercise. And that is also again come back. We regain that wait once we are little complacent or stop exercising. But here, if you change this activity, much of calorie you can burn. And if you see the evolutionary perspective from hunter-gatherer lifestyle to agricultural era, we entered the industrial revolution, the digital era, and evolutionary mismatch took place. We shut down in the computer labs, sedentary occupations, screen-based lifestyles, and the biology designed for movement was lost. So modern inactivity consequences result in obesity. So we have to be physically active as much as possible. If your vehicle has not reached you, don't feel. If you've gone to a wrong terminal, never feel like. You walk down to the next terminal and then and use your joints, use your muscles, use your body, and you'll see up to 2000 calories will be burned by NEAT or non-exercise activity thermogenesis. Just in nutshell, I'm telling the neural regulation of the NEAT, the central nervous system like brain regulation of spontaneous movements, the neural circuits controlling the activity behavior, and the energy sensing mechanism come into actions. The, the arcuate nucleus and the ventromedial hypothalamus, which all of you know, controls the activity. The hypothalamic centers, the lateral hypothalamic area as well, controls this NEAT. And if you make it very often, it becomes a conditioned reflex. The sympathetic nervous system, like energy expenditure, is controlled with homogenic responses and activity stimulation. The reward and motivation pathways like dopamine signaling, movement-related reward mechanism, and behavioral reinforcement come into play. The clinical implications like the neurological influences on obesity, the variability in spontaneous activity and target for the future therapy they come. So it may be fidgeting, it may be postural shift, it may be pace while thinking. Even while talking with your mobile phone, you can take a walk in the corridor and burn some calories. And then daily course and the unplanned activity, it's a spontaneous activity that burns your calorie. The hormonal regulations, again, leptin, ghrelin, the insulin, the thyroxine, and the cortisol come. We know these hormones are very vital in our metabolic control. Leptin is the good hormone, it's adipose tissue derived hormone, and appetite suppression takes place. It gives you satiety. Stimulation of physical activity takes place by the leptin. And the high leptin, there's more movement. The low leptin in the obese, there's the next NEAT. So to encourage NEAT, we need more leptin. So more leptin is good for all of us. Ghrelin is the hunger signaling. More ghrelin, more eating, and more weight gain. The influence on the movement patterns and promote energy-seeking behavior. So high ghrelin is more food-seeking. So if we don't sleep, many people don't sleep, have sleep deprivation, and there you get the very critical situation of increased ghrelin and decreased leptin. And those who do good activities around, they have increased leptin and decreased ghrelin. And you know insulin is the energy storage regulation hormone, and hyperinsulinemia works for the weight gain. It's an anabolic hormone. Thyroxine, again the metabolic rate regulation takes place. The adequate thyroid hormone is the more energy and the movement. So the hypothyroid state need to be corrected. And the cortisol, as you heard in the previous talk, stress response hormone affects the energy balance and impact on the activity levels. These are the hormones you have to be careful around. The leptin, I already told the physiology, the leptin signaling pathways, the activity, resistance, and the relevance. No, it's our friend, and then more leptin makes you thin, more leptin, more NEAT, and it works through this CNS centers of arcuate nucleus and lateral and ventral thalamic nucleus to encourage the physical activities of your use. The thyroid hormones, you know the thyroid physiology, the thermogenesis. The thermogenesis term we are using here in the NEAT is entirely controlled by the thyroid hormone increase the mitochondrial activity. It stimulates the ATP production, the production, enhances the energy turnover and oxygen consumption. In the hypothyroidism, this becomes very badly affected and the need decreases. And the activity and the movement, the thyroid hormone enhance this spontaneous physical activity. So every patient you have to correct the thyroxine and the thyroid, the hyperthyroidism, you get even sarcopenia, burning of the muscles, and then decrease of the NEAT activity. The skeletal muscle as a driver of NEAT is very important. The skeletal muscle physiology, the ATP consumption, the glucose uptake, the fat oxidation, and the metabolic importance. The skeletal muscle, the every step, every posture adjustment, every fidget, every movement, and more movement, higher energy expenditure that suggests us that the muscle movements are critical in your calorie consumption and maintenance of your weight. The adaptive thermogenesis, like the physiological adaptation to energy imbalance and the response to the overfeeding, where the energy in is more than energy out. The response to the calorie restriction, like energy out is more than energy in, is very important. So this adaptation or adaptive thermogenesis is a body's smart response to the energy change, adapting to survive and the maintain the balance. And the biological purpose is protection against the starvation and the energy deficiency. And clinical consequences is the weight loss plateau, slower progression despite continued effort, and increased risk of weight regain. So daily calorie expenditure is up or down based on the energy balance to maintain long-term stability. So I think Dr. Balaji is around, and then I suggest you talk to him who has not taken any GLP. I see many of my doctors friend and their children on GLP therapy having a significant weight loss. But Dr. Balaji has planned his activity, exercise, diet, and the need show well. He has lost more than 30 kilos, and I have seen him losing, and he is an example for a good need where you can burn up to 2000 calories a day. The discovery by James A. Levine, I told it was just known from 1950, around 2000. Dr. Levine worked hard, and he has a lot of contribution at the Mayo Clinic, and most of the major milestones and the publications they date back to around 2000 by James A. Levine from the Mayo Clinic. The overfeeding studies and the study design and the energy dissipation as well as the weight gain differences tell very well that the NEAT burns your calorie and helps you losing. Individual variability are the genetic factors, environmental influences, the psychological factors, biological determinants, and clinical observation. So they all affect. So even if you want, you cannot do. But this is something. Even if you are feeling lethargic, you start like jumping around and you lose. The genetics of NEAT, I have already told. The control is evidence from the twin studies. The heritability of the NEAT is estimated 40 to 70%, with heritability estimates, and then the genetic environment interactions and the candidate genes come into picture. The reduced daily energy expenditure and the chronic positive energy balance, the progressive fat accumulation, sedentary lifestyle effects, and the epidemiological evidence responsible as cause of obesity. And the sitting time, the reduced muscle activation, reduced glucose utilization, reduced calorie expenditure, progressive weight gain are all responsible for the obesity. The energy gap theory tells the energy should be burned more than energy taken, the surplus energy. So long-term weight gain is balanced in the contribution of reduced need towards obesity is very big, and then that will help closing the energy gap if you are practicing the exercise. The adipose tissue biology, I'm not going to the detail in the interest of time, but you will see the lipogenesis and fat storage mechanism that will tell how NEAT is helpful for their metabolism. And the biological compensation, the movements, the resistance to weight gain, and failure to compensation all ensured by NEAT. So the suppression, NEAT suppression takes place, and then the reduced spontaneous activity results in the weight gain, the metabolic adaptation, and the energy conservation are important. And this is weight regains after weight loss. If you lose by drugs or lose by exercise, but the obesity relapse is not there if you practice NEAT and make it a habit. And the glucose metabolism, like skeletal muscle, the GLOT4 translocation, postprandial glucose control or insulin sensitivity, diabetes prevention, lipid metabolism like triglyceride clearance, lipoprotein lipase activity, HDL improvement, fatty acid oxidation, and the cardiometabolic benefits, the inflammatory control like low-grade inflammation, CRP reduction, IL-6, TNF-alpha, and metabolic health benefits, the metabolic syndrome like central obesity, hypertension, dyslipidemia, insulin resistance, and integrated risk reduction, endocrine practice like obesity, diabetes, PCOS, thyroid, and clinical counseling, cardiology practice like primary prevention and secondary prevention, the rehabilitation, heart failure, and long-term outcomes, and the geriatric medicine like frailty, sarcopenia, functional capacity, fall risk reduction, and healthy aging. Everywhere NEAT comes into picture. It's measured by accelerometers, by indirect calorimetry, doubly leveled water. I'm not going to the details. And the clinical strategies to increase NEAT is to standing more, walking breaks, stair climbing, active transportation, as well as the home-based activity. And the key take-home I'll tell before closing my talk is NEAT is the most variable component of total daily energy expenditure, and you can burn highest amount of calorie, up to 2000 calorie a day by NEAT. Low NEAT contributes to significant obesity. NEAT declines during the weight loss, and maintaining NEAT improves the long-term outcomes. NEAT benefits the extend beyond weight loss like metabolic benefits, diabetes prevention, and cardiac protection. Every obesity treatment plan should include NEAT prescription. So NEAT is just not movement, it's lifestyle, it's medicine, it's your control. So let us resolve after this presentation that we ourselves in our life can teach families and friends for this practice, and then every patient along with exercise will just take 10 seconds to talk about NEAT, which will contribute significantly in weight reduction and successful weight management. I thank again Disha for the beautiful opportunity, and I'm sure I'll be able to take up any questions if there. Thank you all.
Thank you, sir. It was an excellent presentation. The floor is open for the questions. Anybody's got any questions?
Any questions?
Sir, I got a question. So now with the current availability of GLP-1 around the corner, is there any studies about NEAT in the weight management?
Yeah, actually, the therapy is incomplete without a lifestyle. Always we advise GLP along with lifestyle. And in lifestyle, diet, exercise is always there. But NEAT has not come to a regular lifestyle advice, which has the potential of burning highest calorie. So there how we want to incorporate it along with GLP. Diet, exercise, non-exercise activity thermogenesis, along with drugs in which case they fail, can collectively control, and out of this all cause in regain. If you stop the drug, ideally GLP is lifelong, but I don't know how long those who are taking will continue. The exercise is also stops in between, but NEAT is something because you have to work, you have to do profession, you have to do family, you have to do gardening daily, you have to sleep, get up and do activities. If you practice this during your lifestyle, the only thing going to help you in the long run.
Thank you, sir.
So I had a question too. I think recent edition of Harrison in the pathobiology of obesity, it was talking about how when we have excess energy storage, our hypothalamus itself triggers us to have more NEAT.
NEAT, yeah.
Right.
Just
And
arcuate nucleus and the
right.
lateral ventral nucleus. That one.
And part of the pathophysiology of obesity is that we lose that mechanism, or it's not as sensitive.
Very right.
So, is there any way we can bring back that sensitivity, or does
Yeah.
voluntarily doing more need bring back the sensitivity?
Voluntarily. Actually, obese people have a tendency for less need. They ask others to give a glass of water. They don't go and collect. If you are thin, you'll be jumping around. If you are thick, you'll be sitting and asking others. So here, the central nervous system has a role, and unfortunately, the need center also becomes dormant once you gain the weight. There, the behavioral practice, your own effort to increase the physical activity, not only decreases the weight, it stimulates the center for more neat activities.
So, need increases need.
Yeah.
Questions, then we can close the session.
Thank
sir.
you. Thank you. Thank you for your time.
Thank you, sir. Thank you, Dr. Jayanta. And thank you, Chair.